Okay, so excuse the fact that I look like shit. I'm on day, I think I'm on day 5. I'm trying to count Friday, Saturday, Sunday, Monday. Yes, I'm 5 days post-op. I will say, I was going to make a video the first day or two, but I just was too out of it. So, I don't know why they put so much stuff to my IV the morning of. So like I'd take 3 Tylenol, Celexa, I think they said, and gabapentin, right? And then I heard that they put in my IV, supposedly, I need to see the notes, Dilaud, because the people that took me said they saw it. So they put Dilaud. I had propofol, Oxycontin, and fentanyl. And then they had put that patch behind my ear. So when I woke up, I was like, okay, I feel okay. I don't think I'm going to puke. Well, like 10 minutes in, the more she was talking to me, I started getting that damn dry cotton mouth. And you know what that means. I don't know if everybody gets that, but that's always been my like salivating, like, uh-oh, here comes the puke. And I'm thinking, oh my God, I don't want to puke. I just had internal surgery. So like there is external, but most of it is internal. So that's why I have to heal for about 6 to 8 weeks. And even then, you still got to be gentle and take it easy for like, 6 months to a year. So I will say that if you can see, I don't know if you can see all this. Look at this. You see my incisions. I'll show you in a minute. I'm in a pillow fort, okay? Like it goes all the way around me. My girlfriend got me. Let me see if I can show you this. So this is called a anxiety weighted animal. So like you can lay it here. You can hold it for support. I actually used it like this. I laid it like this coming home from the hospital for a seatbelt support. So bringing us back to day 1, I woke up, started puking. Now, well, I couldn't puke. I was dry heaving. And I remember saying, no. And the nurse was like, what's wrong? I'm like, I don't want to dry heave. And I said, it's going to mess up it's internal stuff. And I could feel it pulling on there. And I was like, fuck. So she ended up she goes, let me give you some Zofran. Guess what? It didn't work. And when I had gastroparesis real bad, I was given something called Phenagrin. So they got like a bag of Phenagrin, they put it up here, and they're giving it to me. And the first thing I'm thinking is, there's another $1,000 on this bill. And next thing I know, I'm knocked out. Like I'm out cold. I'm trying to talk to people. Like when I first woke up, I was trying to talk. Nothing I said made sense. I was talking like it might as well have been Klingon or something. Like it wasn't words or sentences. So when I got to phase 2 recovery, I started feeling more normal, but that's when they came in and I was puking. So then, once we got to wherever I don't know what phase it was next, they gave me the Phenagrin and I was knocked out. No joke. I was still dry heaving as they were giving me the Phenagrin. Then I kept closing my eyes because I was knocked out, and I was tripping balls. If I've never tripped acid, but that's what it felt like. So I kept saying to them, I'm hallucinating. And she's like, well, I can give you 20 more minutes. And I was like, okay, I don't think I'm in any condition to go home right now, but okay. So she came back 40 minutes later. When I closed my eyes, I don't remember everything. There was like this woman. She had pretty blonde hair. She was handing me stuff. I was talking to people, but I was actually talking out loud from what people told me. I was tripping my balls off. It was just something I've never experienced. And so they came back in and she's like, well, how are you feeling? And I'm like, not good. I'm dizzy. So I just got to a point where I was like, listen, if you want me to go, I'll just go. Because it just felt like, what's the point if, I don't know, I guess they have to get you out, but they clearly said 2 reasons we wouldn't send you home. Your pain, which I'll be honest, my pain was kind of like, eh. The nausea was out of control. I was still dry heaving. So, I don't know. So I'm going to see if you can see this. I was trying to cover up a little bit. So, if you can see, are they all there? Hold on. There's, so sick of incisions. Here's 1, 2. They're starting to bruise a little bit more. My belly button I don't like. 3. It looks like it's an Audi. So I hope I can get my belly button ring in time. As you can see, I started bruising here. That's psoriasis. 4, 5. So I'm going to say this. I'm going to be very honest. This surgery, right? Maybe the first day there was some pain. But then other than that, it's been the gas and the discomfort. And I will just keep it real 100. Where I was at, I'm not 100% sure. They said I have some muscle issues in there. So I had trouble going to the bathroom every single way you can think of. And let's be honest, when you're backed up, that is one of the most uncomfortable feelings ever. So I've always been the type person that goes to the bathroom constantly. Now it's opposite, but I had so many drugs, anesthesia. Had to do an enema. There was like no other way around it. They were getting ready to bring me back to the hospital, and I was like, what else can we try? So other than that, I'm going to say in this moment, so 5 days out, not too bad. The worst part, honest to God, has been the gas and being backed up. And then trying to pee sometimes has been a little difficult. And I look like shit, but I mean, I guess you're not supposed to like a beauty queen, am I right? So that's it. I might make more videos as I go along, but I just want to encourage women. This is more of a woman thing. I'll get more into it deeper when I feel comfortable. But you know your body. As soon as I woke up, I had lower back pain. It's gone. My hip pain, gone. The heaviness feeling, gone. There's just, yeah. I don't know. It's just one of those things where like I said in my other video, when you know, you know, you know. Your body is never going to steer you wrong. Doctors can't know everything. They're going to always try their best to figure it out. But at the end of the day, you got to speak up for you. So I will show you. Look at this. Look at this shit. Let me see if I can show you this. Look at all this shit I'm on. I'm going to try to go like